Nearly every hour of every day, one person will die due to oral and pharyngeal cancer. April is Oral Cancer Awareness Month, and I'm here to discuss the stats, risk factors, signs and symptoms, and more. Hi, my name's Micah, and you're watching Burst TV. First, it's important to define what is oral cancer. According to the National Cancer Institute, oral cancer is cancer of the tissues in the oral cavity, the mouth, or the oropharynx, the part of the throat at the back of the mouth. To understand the gravity of oral cancer, the stats speak for themselves. As reported by the American Association of Oral and Maxillofacial Surgeons, the following statements regard the prevalence of oral cancer. An estimated 49,750 new cases of oral cancer will be diagnosed each year. Oral cancer will claim 9,750 lives annually, and on average, 43% of those diagnosed with the disease will not survive more than 5 years after the diagnosis. While doctors, surgeons, and researchers are constantly working to better understand and identify the cause of oral cancer, there are a few known risk factors. Oral cancer risk factors include tobacco use, both smokeless and smoked. Smokeless does pose a greater risk of oral cancer of the mouth, throat, and esophagus. Alcohol, specifically in combination with tobacco use. Human papillomavirus. Sexually transmitted HPV-16 is the leading cause of oropharyngeal cancer. Sun or tanning bed exposure. It's important to limit your exposure to the sun and tanning bed, and when you know you're going to be there, use a lip balm with a high SPF. And lastly, age. Historically, oral cancer has been a disease of those 40 plus. However, incidence is rising in those under 40. Dental professionals routinely perform oral cancer screenings at dental appointments. However, it's important to be familiar with signs and symptoms for self-exams. Signs and symptoms of oral cancer include leukoplakia, white patches of the oral tissue, erythroleukoplakia, red and white patches of the oral tissue, an abnormal lump or thickening of the oral tissues, a mass or lump in the neck, and a sore on the lip or the mouth that does not heal. The most common sites for oral cancer include the sides of the tongue, the alveolar gingiva and mucosa, underneath the tongue, and the floor of the mouth. It's important to perform self-exams regularly. The more familiar you are with your normal anatomy, the more keen you'll be to notice any changes. If you have any risk factors, it's advised that you make a yearly dental appointment for a professional exam. The earlier cancer is detected, the easier treatment and greater chance for a cure. I hope you found this video to be informational. If you have any questions, please drop those in the comments below. If you like this type of content, don't forget to like and subscribe to our channel here at Burst TV. We put out a new video every week.